Welcome, my name is Aaron Levo. I'm the Vice President of Communications and Public Affairs at Hamilton Health Sciences. Happy as always to be moderating today's town hall. We have a ram-packed agenda with lots of really important updates on work ongoing in our pandemic response and recovery, as well as other issues in the workforce today. So we'll get started. I'm just going to remind everyone, we do have at the end of the town hall a Q&A session. You can pose questions as we go using the Q&A tab. Try to use the Q&A tab for questions. We'll keep the chat function for our celebrations, which is how we conclude each of our town halls. You'll also note that some of our panelists will respond to your questions in writing throughout the course of the town hall, and you can review the responses in the answered tab that you find in the Q&A function at the bottom of your screen. So please, if you didn't ask a question, it might be of interest to you to go and see what the responses are to some of the questions that were asked. And as always, if you have a question after the fact, we'll have an email address for you to send it to. Okay, so first up on our agenda, I'll ask our President and CEO, Rob McIsaac, to join us and give us an update on what we're hearing about today and where we are. So Rob, over to you.
Thanks very much, Aaron. So hello, everybody, and thanks, as always, for taking time to participate in today's session. As we continue to recognize Indigenous History Month and acknowledge Indigenous Peoples Day on June 21st, I think it's quite appropriate that we start with our land acknowledgement, which we've been doing over the past few weeks. We are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. You know, much attention continues to be focused on the devastating impact of residential schools on multiple generations of Indigenous peoples. It's important to remember the people impacted by this are our patients, our coworkers, and our friends, our family. Showing empathy and compassion towards them is so important. And I know I say it almost every week, but please be kind. It will come back to all of us in spades. Today, I'd like to extend a special welcome to a new panel member, Shannon Kitchings, Human Rights and Inclusion Specialist. Shannon will join us a little later on to share details about the resources and learning opportunities available to everybody so that we can continue to support Indigenous care and services across our hospital. I think all of us need to keep in mind, we all need to learn, to listen, and most importantly, to act on these issues. I'd also like to bring your attention to a few other items. I hope you were able to participate in some of the STAR recognition activities this month. I know that the planning team has worked really hard to find ways to reach everyone in the organization in different ways. The celebration continues tomorrow with free soup for all HHS staff and physicians at Burnt Tongue restaurant locations. You have to have your ID with you in order to get the free soup. If you haven't been to the Burnt Tongue, they really do make great soup. So a sincere thank you to everybody at the restaurant for this support. You can get details about this and the other Star Month activities on the hub. The second item I want to highlight is a national survey about the impact of the pandemic on the well-being of staff, physicians, residents, and learners. The external survey is being supported by HHS's Resilience Task Force and executive team. So Dr. Andrea Frolick is here today, and she's going to provide more details on that survey shortly. And finally, please be on the lookout tomorrow for the launch of our 2021 community report and our 2020 environmental report. Next week, I intend to share some highlights from these reports with you, as well as some key events from over the past year. But this report really documents, without a doubt, one of the most difficult and extraordinary years in our lifetime. I am so proud of how our team rose to the occasion time and time again. And I think if you look at the report, it's really astonishing when you consider all that was achieved by our team, by HHS, these past 12 months and more. So it was really a year like no other, but fortunately we have a team like no other. So thank you for your relentless efforts to care for our patients and to support each other. I think, all of you have made such a big difference for our community over the past year, 18 months. We are on the path to restoring our healthcare system. It's going to take some time for us to get there. And once again, it will take all of us coming together to once again rise to the occasion of meeting the needs of our community. Finally, before I sign off, I would just say, if you haven't already, please get vaccinated. Do it for yourself, do it for your family, your teammates, do it for our patients. But please, if you haven't been vaccinated, please get the shot. Thank you all, and I'll turn it back to Aaron.
Thanks very much, Rob. So next up on our agenda, as always, we have our operations update with our Chief Operating Officer and Executive Vice President of Clinical Operations, Sharon Pearson. Sharon, where are we at with our sites and services this week?
Thank you, Aaron, and good morning, everyone. And as Rob has said, we're on the pathway to restoration, and you can see the evidence of that in our COVID numbers today and in my operational update, which is increasingly, I hope, more positive to those of you listening. So we can see today the total numbers of COVID within our organization. There's 15 in our ICUs, 15 on the wards, match there. And we have 7 of the 15 in the general ICU and ECMO. And we've talked about that program previously, but you can see the numbers with respect to our ECMO patients are slowly declining, which is very good news, certainly for the patients, and a reflection of the trajectory that we're seeing with COVID and its intensity. We do continue to care for patients outside of our region. As I mentioned a few reviews ago or updates previously, we don't have the number of patients coming out of region right now, but we're still participating in the census balancing across our hospitals to manage our capacity issues. If you go on to the next slide, we did receive the direction a few weeks ago that we could resume our surgical and procedure activity. At this point, we're hoping by June 21st, so next week, that will be up to 82% actually. So the number changes very quickly of our surgical activity across all of our sites, and about 74% of our procedural activity. So that's great progress. We were sitting at approximately 52% of our pre-COVID surgical activity volume. So good news, it still is very challenging. We do need to maintain that capacity we have in ICU, both for ECMO and for any potential increases in COVID demands that we might see. So we are working on what resources we need to retain within those settings of the JH and the general ICU. There's a group certainly working every day on the process of how we can phase in and advance as quickly as we can, keeping in mind we need to be thoughtful about our decisions, and we do need to align our decision making with Ontario West and the provincial directions. I just noted this week the backlog of cases, that 5,600 cases. That's the cases that we've fallen behind on within HHS during these COVID ramp down periods that we've had. And if you could go on to the next slide. In terms of where we're at with staffing at this point, we do have over 60 staff now. So I think it's closer to 70 that have returned to their home units, which is great news. Plans for another 125 to return in the upcoming weeks. And we still have those that remain to help us out with the critical care and capacity in a few other areas. So again, many thanks to all of those staff that have been supporting this redeployment effort. And then lastly, if we go on to an update on the satellite health facility, if we could just advance. And the slides might be frozen, but the satellite, we continue to advance our capacity at the satellite health facility. We did get good news about the funding that takes us into the end of this fiscal year, which is terrific. And as we've highlighted before, it is a very critical part of our pandemic recovery and provides us much needed added capacity within our organization. And a reminder, we have 90 beds in the satellite health facility and another 46 beds that we work with our partners with in the community. And lastly, the mobile health unit. Again, as I updated last week, we're ready to go. Certainly signs indicating we won't need it, but again, phenomenal work that it was there should we have needed it. And with that, I'll take questions later on if there are any, and I'll pass it back to Aaron.
Thanks very much, Sharon. Next up on our agenda, I'd like to welcome Dr. Dominic Mertz, our Medical Director of Infection Prevention and Control, for an update on the pandemic nationwide, provincially, and locally. Dr. Mertz, what's happening? Are we over? Not yet.
Moving into the right direction. I think in terms of trajectory, pretty much the same message as last week. This is the picture from last week. When we move to the next slide, we see a reduction in case numbers for 100,000 per week in Canada from 32 last week to 24. It continues to decline. When you check today, we are sitting at 22 at the federal level. And you can see that all the provinces are coming down. You see all those nice green arrows here, and quite significantly, typically in the 0.8 to 0.9 range in terms of their RT. Issues currently in the territories where case numbers actually increasing, in particular in Yukon more recently with outbreaks there. But otherwise looking great. When we are looking at Ontario here, and a black line where we expect to be by the end of this week in the range of 20 per 100,000 per week. That's comparable to where we had been back in mid-September. And as you can see, much, much lower than we've ever been between the second and the third wave. Next slide. Hospital-wise, we are back where we've been back in mid-November for total number of patients. And you can see that the difference when you're looking at the dark red versus the lighter red colored columns here at the very right side, there's only a small number of patients who are in hospital and do not require ICU care. So it's first and foremost now ICU patients that continue to be in our system. And in terms of ICU, you can see we are comparable to where the second wave started to peak, but certainly not better than that yet. Next slide. How do we compare to the modeling? First, the oldest one I'm showing today from April 29th, we are doing pretty good, as you can see, better than expected, even the best case scenario. On the next slide, you see the more up-to-date modeling from May 20, and I will show you the one from last week later on, again, outperforming the best case scenario here. We certainly start to see a drop in the slope in terms of going down, but we continue to go down. And considering that Thursdays are the days with the highest case numbers, typically, we are quite low today. So things still moving into the right direction across Ontario, with the exception of Waterloo and Porcupine, which are still struggling. Next slide. ICU-wise, we've pretty much followed the modeling, sitting at 360 as per today, so slightly better than what I inked into here yesterday. So certainly on the right track, but as you notice, going down slowly, which we kept saying for several weeks at this point. Next slide. Here you can see Hamilton. We had that, or those two shoulders, or actually three shoulders going down from the peak of the third wave, but again, had a week with, or a couple of weeks now, pretty much with more or less constant drop to now case numbers comparable to beginning of October. Next slide. In terms of community cases, so cases that aren't linked to close contacts or outbreaks, etc., which we use to guide our policies, we are as low now as we've been towards the end of September. Again, much, much lower than we've ever been between the second and the third wave. So firmly in low epi environment, and planning to change all the policies back to low epi in a week from now, assuming that nothing's going to change. We wanted to wait those 2 weeks after the first reopening and watch what's happening in terms of Delta before we make that step. But it looks like obviously we are on the right track to this time pull the trigger and go back into low epi. So basically what we had in place back in fall. Next slide. In terms of hospital admissions locally, not quite there yet, comparable to where we've been in December. And again, similar picture, only a few patients that need ward level care. The vast majority of patients currently hospitalized are those in the ICU, and the vast majority of those are intubated. Next slide. Where do we sit in terms of vaccines? This is as per a couple of days ago. You can add roughly 1.5% at this point of time for each day. And based on the data from Tuesday, we had 75.2% of the adult population vaccinated with at least one dose, or 73.1% of the 12 plus, so the eligible patient population. And 18.1% fully vaccinated, which means that probably today we will hit the target of 20% fully vaccinated, which is one of the criteria to move to reopening step 2, which at this point of time is scheduled for July 2nd. There's some rumors that it may happen earlier, but certainly for now, we expect that it's happening July 2nd. On the next slide, you see one piece that's concerning to me still is that we are still lacking vaccination of 10% of the long-term care staff, while patients are pretty much fully vaccinated. And with the Hamilton data at the bottom, you see they are more than fully vaccinated. There's probably some issues with the denominator there. Next slide, please. How do we compare internationally? I've shown this before. We are ahead of Israel for more than a week now, and continue to go up in terms of one doses or just first doses, but certainly the slope is getting less steep. So for those next maybe 10, hopefully closer to 20%, it will be a slower progress than what we've seen over the last few weeks. In terms of second doses, on the next slide, you see that we only start picking up speed here, and this will go up very quickly now, the more and more we shift from first doses to second doses. Next slide. So that means that to get where Israel currently is, it will take us probably, well, at the current pace, not even until the end of July, expecting that the pace will increase further with consistently above 200,000 per day vaccinated. We will reach it probably by mid-July. And as you know, Israel was able to pretty much discontinue all their measures at this point of time. Next slide. Now, the curveball that we are dealing with, the Delta VOC, and these are just estimates just to make that clear because of the delay until we get the sequencing results. The science table estimates that roughly, well, almost half of our positive cases at this point are Delta. While this is bad news because it spreads as quickly as we sort of feared it will, it's also good news because we see cases continue to decrease despite the fact that already half of what we see is the Delta variant. Next slide. And this has impact on the modeling, and that's the updated modeling from last week. And when you're looking at the model like this, where from now on cases can either go down, stay pretty much the same, or can go significantly up, that clearly indicates that there's a lot of uncertainty in those models, and it's hard to pinpoint into which direction we will go. There's uncertainty about still to what degree transmissibility is higher with Delta, probably in the range of 50 to 60% higher than with Alpha. But yeah, as I said, that may still change. Vaccine efficacy, I will come back to that, is also a moving target. And then what plays into this are the reopening steps, which again are to some extent a black box, to what extent that may increase the risk of further transmissions. But overall, when we're thinking about the Hamilton modeling that I'm not showing today, what we have for our region is pretty much what you see here with the green and the yellow scenario. So the expectation for us regionally is to be somewhere between the best and the medium case scenario here. Next slide. In terms of ICU admissions, you see that towards the end, mid-July here, you may see a difference when you're looking at those three scenarios. And this is first and foremost because of the vaccine. So we expect, again, a much lower impact on the healthcare system, even if case numbers go up significantly. And this is based on the vaccine data that we have mostly from the UK. And on the next slide, you see a busy table showing what, oh, no, not yet. First, the situation in the United Kingdom. Yeah, no, it's okay, just go to this here. I first had that in before I get into vaccine effectiveness. You see observations per 100,000 per week here. The purple line being the case numbers in UK, which are obviously going up now for more than a month. And then you see a green and the blue line, which are can hardly be seen in the main figure here because they are much, much lower. Those are hospital admissions and death. When you zoom into that and use a logarithmic approach, which is better to see those small changes when you compare those, you will see that there is an uptick in hospitalizations at this point, no changes in death in the UK so far. So the increase in case numbers at this point is resulting in a modest increase in hospital admissions, first and foremost among non-vaccinated people, to some extent about in single vaccinated people, rarely in double vaccinated. Next slide. And here's the busy table that I promised, showing you, I will just focus here on the VE, which is the vaccine effectiveness against hospitalization. And you can see with any vaccine with the alpha covariant on the left-hand side, with one vaccine, we have 78% vaccine effectiveness with one dose against hospital admission, while with Delta, it's 75%. So very comparable. The data that's been scary and is in the media is for symptomatic disease. So first and foremost, mild symptomatic disease that do not require hospital admission, where the protection for with one single dose for Delta is only in the range of 30 to 40%. As you can see, for hospital admissions, even the one dose has a very good effectiveness. When you move to the second dose on the next slide, you will see that we are well above 90% and actually in the same ballpark for Delta as we are for Alpha. So once fully vaccinated, it doesn't matter whether it's a Delta or an Alpha, based on these best estimates at this point, which again, may still change. Looking at on the next slide, Pfizer versus AstraZeneca, you see for hospitalizations for Delta, you see this gap that with the Pfizer vaccine, we already have a vaccine effectiveness of 94% with a single shot, while with AstraZeneca, it's only 71%. With the second shot on the next slide, it's very comparable, somewhere in the mid-90s. You can see in the brackets the area of uncertainty. So it's 96% for Pfizer, can be anywhere between 86 and 99%. Next slide. And this is the take-home message from Public Health England. Pfizer vaccine is 96% effective against hospitalization after 2 doses. The Oxford AstraZeneca is 92% effective against hospitalization. So bottom line, vaccines do work against Delta. It's not perfect. And in particular mild symptomatic disease, we will continue to see. And that's a reminder for everyone. If you are, regardless of whether you're a healthcare worker, you have a patient who's fully vaccinated and is symptomatic, they still require testing. They may still be infected. They may still be able to transmit the infection. So vaccine is not a replacement for testing. I think that's the bottom line, because you may still put those not yet vaccinated at risk, and we aren't quite there yet in terms of double vaccinations, what we are eventually aiming for, which hopefully will be in the 80% plus range of the population. I stop here and hand back to Aaron. Thank you very much.
Thanks very much, Dominic. Good update today. Lots packed in there. Next up on our agenda, we're going to hear from Bruce Squires, our Vice President of Women's and Children's Health, who's been helping to lead efforts around the vaccination push locally. And Bruce, what's happening? How are we doing?
Well, thanks very much, Aaron. I mean, I'm really glad to say that Dominic has really already shown how we're doing. And while COVID numbers are trending downwards, COVID vaccination numbers are certainly trending upwards in a very positive way, both as it relates to first doses and as it relates to second doses. So Dominic's already shared with us the numbers. This summarizes is, again, 76% of adults in Ontario already have received one dose, and as of today will pass 20% of adults having been fully vaccinated. We're a couple days now where we've actually been over 200,000 doses per day. More than 60% of those are currently second doses. So again, that's why that second dose number is going up pretty quickly. And exciting piece of news, the province getting 2.7 million additional doses of a Moderna vaccine, and we'll receive our delivery this weekend, and that will significantly bump up the numbers of vaccines being given in Hamilton and around the province next week, and for the following week as well. So expect an even steeper rise in terms of our vaccination coverage, again, particularly with second doses. So pretty positive news, I think, there. We go to the next slide. Again, look at Hamilton, and we're moving so quick that some of the numbers here are quite dated. We're already past 430,000 vaccine doses administered in Hamilton. That reflects the fact that we've had a couple of days of over 8,000 doses per day in Hamilton across kind of all of the mechanisms in the center of this slide, large-scale vaccination clinics. And next week, we're opening in Hamilton a fourth relatively large-scale clinic at one of our local employers. Mobile vaccine clinics at all sorts of locations, particularly in areas of the city requiring really with lower vaccination coverage, where what we've called hotspots, where there has been, for example, a greater prevalence of COVID, or certainly a lower level of vaccination coverage. Also targeted towards reaching racialized and marginalized communities, including the Indigenous community. We've got Moderna clinics happening in primary care, as well as Pfizer clinics. We're into the hundreds of pharmacies across the city that are now administering vaccinations. And really great news on the youth front as well. 52% of youth actually is the revised number have already received their first dose, and work continues on that front. Go to the next slide. Particular to youth, and something dear to my heart at the Children's Hospital. The work has really got underway this week with the targeted vaccination clinic for youth, and including a portion of that clinic at 293, as well as another clinic at the Ron Joyce Children's Health Center that are focused on youth who have health conditions, complex needs, particularly sensory or behavioral, behavioral, that might affect their vaccine experience or even their comfort. And so you can see here some of the ways, some of the environments that have been created to really ease that experience, and in the end, really drive the protection, the increased protection of not only these youth, but of course the families, the caregivers, and the community around them. And a big call out goes to our child life specialists, as well as to our autism behavioral analysts and our child youth workers, who are playing a big role in these clinics, of course, alongside our physicians, our nurses, our pharmacists, pharmacy techs, and all of the other folks that work so hard on vaccine delivery. Go to the next slide, Aaron. Yeah, so a big piece of this, of course, has been protecting our community in general, but a lot of it is about protecting ourselves and protecting the patients and families who are actually in our clinics. And so we continue to encourage and look to support and drive both vaccination of our team members, but also the reporting and recording on a voluntary self basis through employee health services. We will have in the coming week, and I really signaled this last week, a further campaign really to support vaccine awareness and confidence amongst our teams. And you can see here some of the key tactics. Certainly the really striking t-shirts are part of that, but of course discussions with peers and with experts and champions that help you really to talk about your own situation and your own questions and sometimes your own concerns. Those are really, I think, the most important tactics. And once again, a reminder that this is becoming part of all our team huddle, really to talk about, okay, how are we doing as a group in ensuring that we have disclosed, we have a good understanding of vaccination status across our entire teams. So I think a good news story from me, Aaron, and I think we may be turning to soon where this is no longer part of the town hall, because we've come so far. So in the meantime, happy to continue to answer questions, and back over to you.
Awesome. Thanks very much, Bruce, for that update. Next up on our agenda, I'd like to welcome Dr. Andrea Frolick, who's our Director of Ethics and Healthcare Care Ecology Program. Andrea is here to give us a bit of an update on a really important study that HHS workforce members can take part in about employee well-being during the time of COVID-19. Andrea, what's this all about and how can I sign up?
Great, thanks for the invitation to be here, and thanks for giving some space on the busy agenda today. On behalf of the Resilience and Ethics Task Force, I want to give a big shout out to all redeployed staff and physicians across the organization who've been working so hard during this recent wave. Really thank you for your courage and compassion and your flexibility in responding to the call to care. And I know it's not just redeployed staff, but many of us have taken on new duties and roles and new learning. We've stepped way outside of our comfort zone in order to meet the needs of our patients and our communities over the past 15 months since the global pandemic was declared. And none of us have really been spared. Those of you who are frontline staff, you've had to confront fear of contracting the virus yourselves or bringing it home and adapting to ever-changing clinical protocols. But those of you who are administrative staff or support staff, many of you have had to work alone at home for 15 months without the benefit of a team around you for a whole year. I have a partner myself who has worked at home for 15 months, and he says to me, "You're so lucky you get to go to the hospital and be with people and be with your team and enjoy that sort of human connection that he has really been deprived of over the past year." And as leaders, many of you have had to navigate the competing directives of public health experts and governments and trying to keep our workers safe and whole, but at the same time, keep the hospital running and take care of our sick patients. And on top of all that, you've had to do homeschooling and take care of your kids and take care of your elders without the kind of social supports and community supports that we're accustomed to. One of the favorite parts of my job is that I get to listen to stories of people who work in the organization and stories of patients and families that we care for. And as I've been listening to the stories of COVID, your stories of COVID over the past 15 months, I've come to recognize that there is no one COVID story. Every single one of you has a unique experience of this pandemic. Every single one of you has had to face and endure enormous personal and professional challenges. And every single one of you has learned priceless lessons about what you really value and what you fear and what brings you joy and what brings you meaning to your life. And now, as our society begins to reopen and reemerge from this pandemic, now every single one of us is faced with an opportunity to decide. Do we go back to the way things were before COVID, to the way we did things before the pandemic? Or do we take this opportunity to find a new path forward, where we get to take all the wisdom that we've gathered to create a more compassionate and authentic and sustainable ecology of care for ourselves and our community? And in order to help our health system find a new way forward, we want to hear from you. We want to hear your story and understand how COVID has impacted you both personally and professionally. And that's what this invitation to participate in this national study is really all about. We want to hear your ideas about how HHS can retain some of the great innovations that have emerged during the pandemic, but how we can also create new structures to support your engagement and resilience and well-being as we move into the future. In order to inform this post-COVID vision, all of you are invited to participate in this national study about employee well-being and the impacts of COVID-19. And by all, I mean all staff, all physicians, all residents, and all clinical externs are invited to participate. We're lucky to have this invitation. This study is being conducted by researchers at Carleton University and Ryerson University, internationally renowned researchers, Linda Duxbury and Michael Helinski. And the study incorporates a number of validated tools that have been created to assess the personal and professional impacts of COVID, to explore how people have coped, and to measure the degree of workload overload and burnout experienced by our workforce in order to help identify resources and strategies to support our recovery as a community. And a whole bunch of other healthcare organizations have already participated in this study. St. Joseph's Healthcare Hamilton and Sick Kids and Hamilton Public Health. So we'll really be able to compare ourselves as a health system to our peer hospitals. The study only takes 20 minutes to complete. And I took the study a few days ago, and it actually prompted a lot of helpful reflection for me personally on how COVID has impacted me and my family and my team. So although it's an act of generosity for you to participate in the study to help us understand your experience, it also, I think, will be helpful for you to do a kind of self-assessment of where you're at and what you need going forward. However, the study is totally confidential. It's anonymous. HHS won't collect or receive any employee or physician-specific data. But if we get over 1,000 people participating in the study, we as a health system will receive a report that summarizes the impacts of COVID-19 on the HHS workforce. And we will also receive specific recommendations to help us support your renewal, your restoration, and your recovery going forward. So please, please take time to participate. So if you're a leader, I would ask that you share this link, and the link is available on the hub, and there's a QR code. I think it might be on the next slide as well, that you can link to the study. I'd ask that you take a moment to print the poster that's also available on the hub and post it on your huddle board, or send it around to your staff in your weekly staff newsletter or email. Give your staff breaks. Take time during your team meetings to actually give people that 20 minutes to complete the study on their own while you're together as a team. And I just want to say thank you for taking time to complete the study, to participate, to share your story, to share your ideas about how we can reopen, but also retain all the wisdom that we've experienced and are taking with us. As Helen Keller has said, character cannot be developed in ease and quiet. Only through experience of trial and suffering can the soul be strengthened, can ambition be inspired, and success achieved. And certainly we have built a lot of character together individually and as a community over the course of COVID. And because of the trials you've endured, You have all developed incredible wisdom, and no one can take that away from you. We want to really harvest that wisdom in our days ahead. So thank you for your participation. Thank you for your ongoing engagement in supporting each other, our patients and families. I wish all of you restoration and rest in the summer months ahead. So keep taking care of yourselves and each other. And I look forward to seeing you again soon. Take care. Thanks, Erin.
Thanks very much, Andrea. Great update. Nice quote too, or as my grandmother used to always say, if you don't have a lot of character, you might as well be one, which is why I ended up moderating town halls for a living. So here I am. Next up on our agenda, I'd really like to invite Shannon Kitchings, who is a member of our Human Rights and Inclusion team, who's here to give us an update about really important goings on related to National Indigenous History Awareness Month. Shannon, what do we need to know?
Thank you so much, Erin. So this is National Indigenous History Month, the month of June. And on June 21st, it is Indigenous Peoples Day. And these events are really important to recognize, especially right now when we continue to learn and relearn about the horrors that have occurred in residential schools across Canada. It's important for us to take this time to do this learning and to be engaged with the process of reconciliation as settlers with Indigenous people. And I'd like to start by positioning myself a little bit. I am not Indigenous, I am a settler here in Turtle Island. And so it is my honor and my responsibility to do what I can to learn about the history of Indigenous people. And so I'm going to share with you some highlights of some learning opportunities for you and encourage you to engage with them and learn now for this month of recognition and going forward. So if we can go to the next slide, please. So thank you, Rob, for opening today's town hall with land acknowledgement. This land acknowledgement was developed in collaboration with local chiefs and elders and other Indigenous leaders and community members, and it's an opportunity to really deepen our understanding. Offering a land acknowledgement at the start of any gathering is an important way to recognize and respect the relationship with land that Indigenous people have, and to really reflect on your own relationship with the land that you occupy. And so it's an important commitment in reconciliation and decolonization. Land acknowledgements should be offered in a way that allows for some time and some space to really engage with some meaningful reflection on what it means to live and work and play on Indigenous lands. And so I encourage folks to think about it as a moment to really do some deep thinking in a process of ongoing thinking. And so with that, I'd like to repeat the land acknowledgement now and state that we are privileged to provide care on lands that Indigenous people have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous people as keepers of this land. Hamilton is located on the traditional territory of the Mississaugas, the Haudenosaunee, and the Anishinaabe in lands protected by the Dish with One Spoon Wampum Agreement. And I'm going to offer us actually a moment of silence just to think about and reflect on your relationship with this land and how you have related and engaged with this land. So take a moment and breathe, feel the ground beneath your feet if you would like, and think about this space and this territory and how you come to be here. Thank you for continuing that learning and that reflection. I'd also like to share a little bit of a tool and a resource that Human Rights and Inclusion team has developed. You can see on this slide, this is a one-pager about the use of land acknowledgements, why and how and when to use land acknowledgements, and some general tips. This one-pager was created with the generous time and commitment and help of Dina Clot, our Indigenous patient navigator, and Stephanie Rojance, Indigenous outreach coordinator. And I'm particularly grateful for their leadership and their wisdom in creating this tool and in their support and help across the board in general. So thank you to those folks. You can find this tool on the Human Rights and Inclusion Team's resource hub page, as well as a number of other really important resources. And so I'd like to also continue in this recognition and acknowledgement of some of the colleagues and collaborators we've had in Indigenous spaces, and move to the next slide, please, and take some time to look at our signs of welcome. You may have seen some of the signs of welcome. Depending on where you're located, you may have only seen one. There are 4 in total. And so I'd like to take a little bit of time to recognize the artists that created these and the relationship that IHS built with these individuals to create these welcome signs. So this first one is an elder with a smudge bowl and eagle feather. And it is adapted by artist Jay Havens from a mural that he created for Michaela's Room at McMaster Children's Hospital. Jay Havens is a multidisciplinary artist of Haudenosaunee, Mohawk, and Scottish Canadian ancestry. He is a proud member of the 6 Nations of the Grand River Mohawk Bear Clan. Next slide. This particular image is the image of 3 moccasins, and it's an adaptation from an artwork created by Philip Cote for the Moccasin Identifier Project. This artist is Shawnee Lakota Potawatomi Ojibwe from Moose Deer Point First Nation and a graduate of OCAD, the Ontario College of Art and Design. And the Moccasin Identifier Project was a collaborative project with Carolyn King and the Mississaugas of the Credit First Nations to be a teaching tool and public awareness building program for treaty relationships between Indigenous and non-Indigenous Canadians. And I think that's important because we are all treaty people, and these are opportunities that have been developed to reflect on that relationship and establish good relations. Next slide, please. This particular image was created by Tracy Anthony. Turtle and 7 Generations includes the image of a turtle. The feather on its back has 7 segments reflecting on the 7 generations principle, but the decisions we make today should reflect in a sustainable world 7 generations into the future. The 4 legs of the turtle represents the 4 directions, such as those found in the medicine wheel. And I think that 7 generations principle is a really important one to reflect on how what we do today leads into the future 7 generations from now for our children, our grandchildren, and so forth. Tracy Anthony's mother is Mississauga Ojibwe from the Mississaugas of the Credit First Nation Reserve, and his father is Delaware Lenni Lenape from the 6 Nations of the Grand River Reserve. Next slide, please. And finally, this beautiful image was created by Arnold Jacobs. It depicts the Sky Woman, the mother goddess descending to earth. Water birds carry her down to the sea and set her on the back of a turtle, Turtle Island, which becomes her home. Arnold Jacobs is an Onondaga artist raised within the traditional culture and language of 6 Nations of the Grand River Territory, where he resides with his family. This image in general also really allows us to take some thought and consider that Turtle Island is home to many, and that we are in relation with a number of communities and a number of traditional people who have been stewards of this space. And these artists took time and dedicated some of their creative work to these welcome signs. I'm very grateful for that and offer thanks for that. And also note that there are specific relationships with these pieces of artwork. And so any consideration to utilize them in any way should really be considered carefully, because we have specific guidelines around that, as is necessary in respecting relationships with artists in general. These collaborations were an important part of our welcoming in this space. So thank you for these welcome signs. And if we can go to the next slide, I have listed here with my team a number of additional resources. So Indigenous History Month really is an opportunity to learn and to grow and to be in a significant and important relationship with this land, with the Indigenous people who have stewarded this land and continue to do so. And so please take a moment to take a look at some of these resources. So I will go through them for you. The first is an upcoming event for Indigenous Peoples Day, and it is on June 21st. It is being hosted by the City of Hamilton, and you can view it from your homes or from your workspaces. The next two items are policies we have within HHS. The first is the land acknowledgement policy. I encourage you to review that document, and I really encourage leaders to continue or to begin to use land acknowledgements in many of your spaces, in team meetings, in gatherings of all sorts. It is designed to be a repeated reminder of our relationship with the land and with Indigenous people. So please feel free to start using it, continue using it, encourage using it. And the policy is there for you to help with that. The smudging ceremony protocol also exists in our policy library, and there's a really great video about smudging ceremony that I really encourage folks to view. It's a very important video that helps understand some of the cultural significance of the protocol and of smudging, and helps in your learning as well. HHS Indigenous care and services, the information for how we share our learning and how we do our best to commit to healthy and safer healthcare for patients and families in our Indigenous communities are located also. The Truth and Reconciliation Commission final report and calls to action. Take an extra moment to talk about this one. If you haven't read the report, please take a look at it. And if that seems a little overwhelming or something that you're not ready for or don't feel like you have time for, at the very least, read the 94 calls to action. It's not a long read, and it's a very important one. This was a long, very difficult and challenging process that really brought to light a lot of information that many settlers didn't know about the residential school system. And it is an important step in reconciliation to be familiar with those calls to action. So please take some time to review them. And I also would just suggest that if you don't know where to start in your own learning, there are lots of resources available on our team's resource page, but also a really quick internet search can help. If you haven't already learned the names of the nations that are the stewards of the land on which you live, or where you were born, if you were born on Turtle Island, please learn them. Learn how to pronounce them. If pronunciation is a challenge, again, a quick internet search with the word pronounce and the name of the nation will typically give you an audio file so you can hear those pronunciations. Take a look at those 94 calls to action, review or check out the website for Orange Shirt Day. There's really incredible Indigenous-led work happening in those spaces for Every Child Matters. Take some time to learn what you can and figure out what you don't know and fill in those gaps. And we're happy to help you with that here at our team. And you can email us and we would help you with that as well. So please check out our resource page. The Center for People Development has courses, and we are happy to help and support you. Thank you so much. If you go to the last slide, this is the upcoming event on Monday, and I encourage you to spend some time, even if it's just 5 minutes every day, to learn what you can, to honor those relationships and really establish good relations with our Indigenous neighbors, colleagues, and friends. Thank you so much. Back to you, Aaron.
Thanks so much, Shannon, for sharing all of that. Really great information packed in there. I noticed that, okay, so we're going to do our Q&A now. I noticed that one of our participants, Andrea Young, has a hand up. I'm just going to move forward to a written question, just in case Andrea did that by mistake. Sometimes it happens. I noticed another hand just came up, Perry P. So we'll get to those questions in just a moment after. There's a kind of a repeating question in the Q&A today about the potential mandatory vaccination. Is it something that would be considered in a hospital environment, and potentially also is it something that might be considered in the broader society to consider teachers, other essential workers? Bruce, you've come on camera. Is there some insight you can offer to us about what's the discussions that are occurring around this matter?
Yeah, thanks very much, Aaron. And like so many things that are, that continue to evolve in relation to COVID and certainly vaccination, because it's new. This is something that is likely to continue to evolve in the coming weeks and months. At its core, any decision around mandatory vaccinations is likely required to come from the province, and not something that an individual employer like HHS would be able to do. The province has recently put in place some regulations that allow for a process around some mandatory requirements for long-term care workers who, of course, work with those who have been most vulnerable from a morbidity and mortality perspective to COVID-19. And those requirements really are sort of have three components. Either the individual must have received and completed a vaccination, or must have provided medical documentation as to why they are unable to receive the COVID-19 vaccination, or have completed a mandatory education and awareness module, really, that outlines the benefits, the safety, and other considerations in relation to the COVID-19 vaccine. Again, that's been put in place for long-term care workers. So, you know, there's discussions, I think, on this at provincial levels, but at this point, and I suspect not in any imminent time frame will we see a move towards mandatory vaccination outside of that long-term care home environment.
Thanks for the insight, Bruce. Just want to encourage all of our participants to take a look at the Q&A tab and the answered questions. 14 answered questions in there today, covering a wide range of things from emerging science around vaccines, as well as how we're tracking COVID, vaccination for kids, etc. So I see Perry P still has a hand up, so I'll go to the line now and see if you want to answer or ask your question live. You'll receive a prompt. Perry P, go ahead. Okay, well, we might be having a challenge with that. We've as yet not had a really high success rate with the live questions, but we're going to work on that. In the meantime, I'm going to suggest we transition to our celebrations. We're almost at the end of our time together, and I want to be respectful of that. I know people have lots on their plates today. So if you would like to make a celebration, you can do so by typing it into the chat box, which is at the bottom of your screen. You could also raise your hand, and we'll try our very best to get you unmuted and available to give that celebration live. I hope we can make it work if that's the case. Rob, I see one already in here from Michelle Cassidy to Shannon. Welcome, Shannon. Great to have you on our incredible HHS Human Rights and Inclusion team. Thank you for your excellent conscious raising learning experience. So thanks very much. And yeah, for sure. Thanks to Shannon. Kelly Campbell, I see you've come on camera.
Yeah, thanks, Aaron. I just wanted to put a plug in for our 2021 environmental report that'll be coming out, I believe, tomorrow for staff. Really highlights, despite the pandemic, and actually using the pandemic as a way to advance many of our environmental initiatives. So it's a short read, but certainly well worth it to understand all the things that go on behind the scenes that staff may not be aware of that contribute to our environmental response to the city. We've won a couple of awards from Sustainable Hamilton Burlington this year, so lots to be proud of.
Absolutely.
Yeah, in a similar vein, I just wanted to do a shout out to you and to your team for all the great work on our community report, which is being published today or tomorrow, which I referred to in my opening remarks. I think it's a really great effort and such a nice tribute to all the work that our team has accomplished over the last year. So great work, Aaron, to you and the whole communications team, who I think more broadly serves us very well.
Yeah, it's a real treat to tell the stories of this place for sure. Both those reports will be available via the hub for our viewing audience today, so you can take a look at them there. I see one celebration here from Deb Rackenjack regarding the Good Food and CIBC donation of meal kits, which rolled out this week, which was very nice to see. I think they distributed some 300,000 odd across the hospital sector in Ontario, and we had a share to distribute for workers at Hamilton Health Sciences. So thank you, Deb, for pointing that out and for your work making that possible. Okay, well, Rob, we're at 12:31. I'm going to leave it to you for final words, and we'll see you next time.
Yeah, thanks everybody for coming today. As always, I think it was a really good agenda today, and a review of the issues that are probably top of mind for most of us. I think there's lots of great reason for us to be feeling good about where we're at. Of course, we can't stop being careful and prudent, but the weather's turned and the numbers are all looking positive. So I think it's very rejuvenating, at least from my perspective. So thanks all for the work that you're doing, and hope you get to enjoy some of this good weather in the next few days. Cheers, everybody.